Hey guys, it's Anne. I'm going to be talking about mild traumatic brain injury. We're going to get a little bit more specific and talk most of the time about concussions or mild traumatic brain injury. So to start off, we're going to get a little bit of a broad history of traumatic brain injury. So according to Zemek, it's an invisible injury that affects children, the elderly, athletes, military personnel, and victims of motor vehicle collisions and physical altercations. Every year, at least 1.7 million TBIs occur in the United States across all age groups, and they are a contributing factor in about a third of all injury-related deaths. Mild TBIs constitutes about 70 to 90% of all head injuries. Traumatic brain injury, or is referred to as TBI, occurs when the brain is damaged by an external mechanical force. The two types of TBIs are open or penetrating, and then closed brain injuries. So the open brain injury occurs if the skull is fractured or penetrated, kind of like with a gunshot wound. Closed brain injury occurs if the brain slams against the skull or the brain twists within the skull. The injury can be the result of one or more causes, such as a fall, a vehicle collision, sport injury, an explosive blast, and violence including domestic abuse, child abuse, gunshot wound, and shaken baby syndrome. That's according to Patterson and Stanton. There are measurement tools used to gauge the patient's level of severity. Predictors of functioning, indicators for rehabilitation services. The most commonly used assessment and treatments are the Glasgow Coma Scale, the Rancho Los Amigos Cognitive Scale, and the Disability Rating Scale. The Glasgow Coma Scale is widely used during assessment and to classify the extent of the injury. The Glasgow scale assesses the response of the eye, verbal, and motor responses. The injury is classified as mild, moderate, and severe based on the levels of cognitive responses, lengths of unconsciousness, and awareness. A mild TBI is the most prevalent classification diagnosed and is often referred to as a concussion. And we're going to get into a little more about that. So mild TBI is characterized by the loss of consciousness and disorientation lasting 30 minutes or less. And there might not be any loss of consciousness with a concussion. There's also dysfunction of memory around the time of the injury and neurological or neuropsychological dysfunction. Because mild TBI is an invisible disease, there has been some speculation as to the legitimacy of the symptoms, according to Evans. So in the 19th century, the symptoms following a whiplash were called railway or railroad spine because of injuries sustained on trains. In 1879, those complaining of symptoms were blamed for having compensation neurosis when the railroad began compensating individuals who were injured as workers or passengers on a train. Society also accused symptom bearers of having hysteria. During World War I, soldiers with symptoms after close proximity to explosives were diagnosed with shell shock. By World War II, the term post-trauma concussion state was being used. Although post-concussion syndrome, which we'll get a little bit more into detail about later, was introduced in 1941, the label accident neurosis was coined in 1961. And it was explained that the symptoms only occur when people are being compensated for an injury. So there is some stigma and uncertainty when it comes to concussions. I know that there's a movie that came out recently with Will Smith. I haven't seen it yet, but there is a lot more recognition now. So symptoms, according to Shukla and Devi, the symptoms are associated with mild TBI are often overlooked, and some symptoms may present themselves weeks after the traumatic event. So some common symptoms of mild TBI include visual disturbances, memory loss, poor attention or concentration, sleep disturbances, loss of balance, emotional disturbances, and seizures. Other symptoms associated with mild TBI include loss of smell, mood changes, getting lost or confused, and slowness in thinking. According to Goldberg, we'll talk a little about the progression. So while there are guidelines for recovery, there can be a wide individual variation in the time frame for recovery. It can take several weeks or several months for symptoms to fully resolve. And some people have a more severe concussion, but we're just going to kind of look at the overview of it. When recovering from a concussion, there are good and bad days of recovery. So most patients will try to do as much as they can on the good days and might overdo it. This can lead to bad days and will bring back more symptoms that had been resolved, and this causes an increase to the length of recovery. So some early symptoms would include a headache, dizziness or vertigo, lack of awareness of surroundings, nausea with or without memory, dysfunction, and vomiting. Some later symptoms, depending on the severity of it, they might have a persistent low-grade headache, some lightheadedness, poor attention and concentration, excessiveness or easy fatigue, intolerance of bright lights or difficulty focusing vision, intolerance of loud noises, ringing in the ears, anxiety and depressed mood, irritability and low frustration tolerance. So some of these symptoms, as you can see, might be doubted by family members or doctors, especially, which we've probably seen when it comes to poor attention or concentration, fatigue, and then the anxiety and depression. And so like I said, they're often overlooked. So some other diagnoses that can come from a concussion would be post-concussion syndrome. And that can be diagnosed if symptoms of a mild TBI persist weeks after the injury. Some places, they say that it happens, won't diagnose until 3 months, but normally it's about a couple weeks after the injury. So second impact syndrome occurs if the original concussion is not fully healed and a second concussion occurs. This can lead to death or severe disability similar to that of a severe TBI. And that's something that you kind of see a lot more in sports agencies trying to fight against. There's also chronic traumatic encephalopathy. Develops when a person has had repetitive brain injuries. Symptoms typically appear 8 to 10 years after a history of multiple brain injuries, and it can lead to the development of dementia. So this used to be called punch drunk, and it was tied to a lot of boxers who got hit in the head a lot because it's boxing. So for the prognosis covered by Goldberg, can be permanent disability is thought to occur in 10% of the mild injuries. Most mild TBI is completely resolved within 3 weeks, and almost all people with mild TBI are able to live independently and return to the jobs they had before the injury. Although a portion have mild cognitive social impairments. When cared for properly and necessary rest and slow progression of physical activity, school, or work, the mild TBI symptoms diminish. We'll cover that a lot, so hopefully you'll remember that it takes a long time, a lot of rest to recover. But new awareness of the impact and frequency of mild TBI has brought about new research and prevention initiatives. So kind of going over lifespan, since this is often an acute disorder, there are some lasting effects. So instead of going through, like if someone had a TBI young in life and through that, the lifespan, we're going to kind of look at how it influences each age. So older adolescents, ages 15 to 19 years, and older adults, ages 65 and older, and then males across all age groups are most likely to sustain a TBI. Each year, 500,000 children ages birth to 14 are admitted at emergency rooms for traumatic brain injury. For children, the risk of injury is higher birth to 4 years and 15 to 19. In infants, the neck is more flexible and they have an increased head-to-body ratio, which can account for kind of the high probability of injury. For children 5 to 18 years of age, the most common cause of injury is sports-related. Other causes for mild TBI are actively related, such as playground instances, bike riding, and skating. For recovery, it is important that children slowly resume their regular routine and avoid risky activities until they have fully recovered. In years past, some thought that children's brains would heal more efficiently because the brain is more malleable as it develops. However, we now know that the risks can be more dramatic for children than other age groups because an injury can impact brain development. Brain injury may be more challenging to children because they do not have the same coping skills most adults have acquired, or we hope to have acquired. Symptoms of children may be more confusing and distressing, and the shock and impairments they face during recovery. So it can be pretty traumatic for a young child. People 65 years and older have the highest rates of TBI-related hospitalizations. So the elderly population have several barriers to recovery. Most of the population have other health concerns, such as pre-existing health concerns, secondary conditions to the TBI, and cognitive impairment can increase treatment time. There's some evidence that the medication that they take, a lot of elderly patients take, can cause them to be more susceptible to concussions. The most common cause of mild TBI in the elderly are falls and motor vehicle collisions. And that was from Crawford and Simon Taylor. So now we're going to get through the psychosocial spiritual implications. So starting with psychology, found some information from Osborne, Matthias, and Fairweather-Schmidt. Due to the integral responsibilities of the brain, behavior and psychological norms may be altered. Altered cognitions, moods, and sleep patterns affect every aspect of a person. It is important to normalize and provide helpful solutions to patients with mild TBI during recovery. An individual may feel guilt about having an injury depending on the circumstances. They may also feel that others blame them for adding strain to their system in their absence during recovery, whether at home, at school, or at work. This is an invisible disease. The patient's symptoms may not be taken seriously by themselves or even their support system. As with most illnesses, the patient may feel more vulnerable due to their limitations. Halting all activities during recovery can be difficult for some, as activities may be part of their social circle or ways to cope, such as exercise or in different leagues. In some cases, the injury is a result of a traumatic experience, which could increase emotional distress. Attention and concentration deficits, along with other symptoms, may cause the individual to feel insecure or shame. Mental deficits could affect the patients months or years after the injury. So it's something to kind of keep in mind when you're working with a patient, to kind of check in and see if they're having any symptoms after that time. So going on to the social, I have some information from Cole, Moore, Gans, Shin, D'Esposito, Harrell, and Shembri. So within the family, some of the roles and responsibilities will need to be adjusted to accommodate the recovering family member. They will also need to be supportive of the mood changes and the greater assistance needed by the individual. Relationships may be difficult to maintain as the individual may have memory loss, inattention, and learning impairments to various degrees. Communication to schools, work, friends, and coaches is important to properly support the patient, which is something that we can encourage. In order to allow the brain to rest, the individual must isolate themselves from stimulation such as friends, social media, technology, and hobbies. The individual may also take a break from school, sports, work, and certain exercises. The pressure of everyday life may influence the individual's adherence to treatment. A child or teenager may feel pressure and anxiety about missing school. Teenagers or young adults may think that they need to return to sports to hold their place or to gain attention from coaches, and in the case of any scholarships coming up. Adults need to take time off of work, which could result in a buildup of tasks or loss of wages. Social support is an important part of recovery that, when obtained, can improve healing and increase alliances with the support system, which we hope will happen. So according for spiritual, Cole and his colleagues said that the individual may need to avoid large groups and limit extra stimulation. So the religious events or practices may need to be avoided, such as church or youth groups or Bible studies. And at first, reading small print can put a strain on the brain and could hinder the experience of reading faith-based materials, which can be distressing to someone that's part of their ritual and faith practices. As with any illness or traumatic event, the individual may grow stronger in their faith, or it could develop into a wedge between the patient and their belief system. If faith is important to the patient, their faith community may offer support and assistance during treatment. So going to some about the culture and diversity issues. I saw kind of some more general. I didn't find a lot about the specific beliefs about the illness itself, but kind of the coping across different cultures and diversity. So it is shown, I got a lot of this from Gary, Ariano, Lasprilla, and Stevens. It is shown in research that minorities often receive inadequate medical care compared to their white counterparts. This may be due to low agency of the patient, poor care from the provider, and the complexities of care within the medical system. Regardless of the culture, it is important that everyone responsible for the care of the patient understands the injury, the symptoms, and the treatment. This can include family, medical, and mental health providers, teachers, family, friends, peers, and members of your social activities. It is important to have a discussion about the complexities of brain injury and the variety of symptoms to expect, such as those mood disturbances, especially. When there is misconception about an illness, there is a risk that there will be heightened expectations. When those expectations are not met, it can lead to discouragement within themselves, with the support received, or of a distrust of the medical providers. Especially with mild TBI, it is imperative that the treatment remains slow and to not cause more risk or injury. The family structure of a patient will affect the care the individual will receive. So if the family is adaptable, they can support the patient for some time. In cultures such as Latinos, the extended family is often willing to provide aid. However, if the family has rigid family roles, it will be challenging for the family to adapt and care for the patient. When the family is not supportive, there may be pressure for the patient to recover faster and lead to poor recovery. Just think about a mom who is kind of the ringleader of the family, or the dad who's a breadwinner. It could be hard to take on those new responsibilities, and so it could kind of increase that pressure to recover. So cultures react to pain differently. Some cultures understand that pain is not weakness and are more open to receiving help. The Western culture often takes on the view of suffer in silence or take it like a man. Because of the accepted view, people often refuse, because it's not accepted, often refuse help or are not willing to seek expert advice. Socioeconomic status may affect rehabilitation. Those with lower access to health care or fewer means dedicated to health may not have the resources to be assessed or to be monitored. The medication may not be a priority as well. Because mild TBI is an invisible disease, it's likely that an expensive medical visit will be avoided until the symptoms become distressing. So with the concussion, some parents might try to put off having a hefty ER bill. And and that could cause some more problems for recovery. So kind of getting into more of the treatment aspects. I got a lot of the main medical treatment from the Mayo Clinic. And this care is often provided by the emergency department, primary care provider, and often passed on to the families. So a patient must physically and mentally rest to recover from a concussion, like we said. They need to avoid general physical exertion, including sports or any vigorous activities, until there are no symptoms. They're to limit activities that require thinking and mental concentration, such as playing video games, watching TV, schoolwork, reading, texting, and using a computer. So yes, that includes your phone, and that may be troublesome to a lot of people. It's recommended to have shortened school day or work days, to take breaks during the day, or to have reduced school workloads or work assignments as you recover. So it's good to gradually add more activities that involve thinking, such as doing more schoolwork or work assignments, or increasing your time spent at school or work. You can use a medication to alleviate the pain from headaches, but it should be approved by your doctor, of course. No one should return to play or vigorous activities while signs or symptoms of a concussion are present. Experts recommend that adults, children, adolescents not return to play on the same day as the injury. Whenever the symptoms or the concussion is a little bit more severe, it might be recommended for physical therapy. And so that will help the patients rest and recover. Help them restore strength and endurance especially if they have to rest for a long time to build up those muscles again. And they can help by improving balance and stopping dizziness. Can help reduce headaches, and will provide guidance on returning to normal activities or sports. A neuropsychologist or neurologist might be consulted. And this is to kind of conduct evaluations. It can be conducted with patients, family, and other providers. And it can help differentiate between the psychiatric and neurological symptoms. So psychological treatment can be provided by a therapist, counselor, or as medical family therapists. Psychoeducation can be very helpful to the patient and their support system during the recovery process. Trauma therapy may also be appropriate depending on the conditions of the injury. Ponsford, Wong, and Schongber, McKay, and Haynes shared how CBT allows clinicians to aid the patients with maladaptive behavior responses, cognitive appraisals, and the impact of symptoms on daily life. Because resting the brain is so vital to recovery, mindfulness and relaxation techniques can not only help with the symptoms, but also the psychosocial impact of the injury. Some other resources could be from an occupational therapist or a case manager. It's suggested by Crawford and Simon Taylor. And this can help them with self-care, some home management, community integration, support groups, and teach techniques to help compensate for some of the symptoms or disabilities. I also found some blogs that had some good Eastern or interesting Eastern strategies for healing. So one of them is the herbal remedies, and you can find them at Herbalist or some health food stores. And of course, recommend that always make sure that they're safe. So omega-3 fats can help promote the reconnection of damaged neurons to the brain. Turmeric it relieves the inflammation, promotes effective blood flow throughout the body to ensure enough oxygen flows to the brain. Another one is ginkgo, and it helps to reduce inflammation in your brain. It promotes circulation to the brain and improves moods. Some other strategies or treatments is acupuncture. And it's provided by acupuncturists, chiropractors, and some medical doctors. And of course, make sure that they're certified and have good training. But this works to rebalance the body through positive and negative energy. It may block pain impulse from reaching the spinal cord, and it stimulates the nervous system. There is evidence that it can relieve nausea and headaches. Another one, which I would love to do, is to have a massage. So with massage therapy by a masseuse. Of course, there's different massages, but there's healing massages that kind of cater to people with concussions or with health concerns. So this helps to restore proper function throughout the body. It improves the circulation, the flow of lymph node fluid, and the metabolism of waste in the body. This works to rejuvenate the brain by allowing more oxygen and nutrients to reach the cells and tissues. It can stimulate inactive muscles due to injury or low use, which the low use could be because of the long recovery or depending on the injury. This can also relieve stress, depression, and anxiety when used regularly. Some other options that are kind of included in the Eastern treatment would be prayer, reflexology, healing touch, and there's several more that I probably couldn't pronounce or explain as well to you guys. So that's kind of all the information I have. I wanted to kind of go over some objectives that you can use when working as a medical family therapist with patients and their families with mild TBI. So it's good to ensure that the patient and family understands the diagnosis and treatment plan, and to promote agency and communion. It's also good to ensure that the family understands the treatment and follow up with appointments. You can help them by writing down important information and to set reminders, and obviously reiterate that the importance of following up with a brain injury. You can discuss the limitations and possible changes in mood that the patient might have, explain the importance of rest and possible changes in personality. Another suggestion would be to discuss family roles and expectations during recovery. To kind of explain the value of support and patience with the patient and the family. Another way is to encourage communication with their peers, work or school, and social contacts. You can do this by discussing the important relationships and who has the most contact with the patient. Lastly, to encourage follow-up and support from the medical community, kind of like the physical therapist, the neurologist, occupational therapist, and other resources. And we can provide information about other services in the community and refer them to a therapist. Can be helpful. And I know that's a lot. You might not be able to do it in the first interaction, but if you have a longer interaction, you can kind of go more in depth in those. And those are all listed in the handout provided. Thank you so much for listening, and I look forward to hearing all of your presentations. All right, bye.